Hello, everyone. Welcome to the Blakely Health Innovation Series Wellness Webinar. It's your move. Thank you for your interest in this topic and for joining us today. My name is Arlene Boyce, and I have the honor of serving as Director of Development with Toronto Rehab Foundation, where we support the incredible work of Toronto Rehabilitation Institute, where we aim to help people live active, healthier, and more independent lives. As a proud member of the University Health Network, our 7 hospital sites support the recovery and return back to home of individuals affected by aging and health conditions that include brain and spinal cord injuries, heart disease, stroke, cancer, and more. And in our efforts to promote health and wellness, Toronto Rehab Foundation is proud to host this series of wellness webinars led by our experts who share valuable health information and provide you with the tools to live a healthier life. We're delighted to have several viewers, in fact, hundreds of viewers from across the country today. And I understand there are some viewers from India as well, so welcome. Also joining us are our colleagues from University Health Network and other hospitals. So I'd like to just take a moment, especially in light of this time that we're in, to take a moment to extend on behalf of myself, and I'm sure the viewers that are joining us today, an incredible thank you to all the health professionals whose commitment over the past 3 months has really helped guide us through the various stages of the pandemic. We're indebted to each and every one of you for your continuing efforts here and around the globe. Thank you. And before we begin today's session, I'd also like to acknowledge the sponsors whose generosity has made this webinar possible. Thank you to Liquorlin, Capital, Raymond James, Shop Wellwise, presented by Shoppers Drug Mart, McLeish Orlando Lawyers, Oatley Vigman Lawyers, 33-7, Bear, and Scotiabank. And I'm also pleased to announce that joining this esteemed group of sponsors for today's webinar is the Canada-India Foundation, who for a number of years has been a committed partner of Toronto Rehab. Thank you for your ongoing support and wonderful support. So just a reminder that this is an interactive webinar. And at the end of the session, there will be a question and answer period. So I encourage you to participate by sending in your questions to trf@uhn.ca. And I repeat, that's trf@uhn.ca. And you'll be seeing this, this address at the bottom of the screen throughout the presentation. So without further ado, it gives me great pleasure to introduce Dr. Paul O. He is our presenter and moderator today. Dr. O is the Medical Director of the Cardiovascular Prevention and Rehabilitation Program at Toronto Rehab and the Peter Munk Cardiac Center, where he also holds the Good Life Fitness Chair in Cardiovascular Rehabilitation and Prevention. Welcome, Dr. O.
Thanks very much, Arlene. It is indeed a pleasure to be with all of you virtually today, talking about a subject that we have a great deal of passion for within our program and with all of our colleagues. I'm going to set the stage for my 2 fellow presenters today by talking a bit about background of why physical activity matters. A few things that we'll cover off very quickly. A Canadian perspective on where we're at in terms of population physical activity patterns and why this is such an important issue related to costs and health impacts of inactivity. Turning then to a more positive kind of tone about why being active will actually reap a whole bunch of benefits. Touch a little bit about where we are going in terms of physical activity and chronic disease. Our colleagues, Dr. Langelet and Roberta Link, will speak about physical activity in cancer and exercise at home, respectively. And then we'll go through a robust Q&A session towards the end of this presentation. So this first part, we'd like to present a landscape about where we're at in terms of physical activity guidelines, shed some light on the prevalence of inactivity and its impact on the economy and subsequent risk through our lifetimes, and think about the connections between physical activity and optimizing health as an equation, very apropos for this Blakely Health Innovation Series. Let's start with the recommendations around physical activity. And whether we look at Canadian, American, or international guidelines, or indeed across a number of disease categories, we find very specific and consistent information with these sorts of numbers that are sent as benchmarks for us. We should endeavor to get 150 minutes a week or more of moderate intensity aerobic activity. That is physical activities of any sort, walking, cycling, swimming, jogging, yoga at a pace, anything that can get your heart beating faster, you a little bit short of breath and a little bit sweaty. All of that will count in the moderate to intensity aerobic activity. Now, it doesn't mean that 149 minutes isn't beneficial to you, or that 150 minutes, over 150 minutes is too much. It's a continuum. And wherever you're starting, if you get a little bit more, that's terrific. As a population guideline, if we can get most people moving to the 150 minutes, we'll reap a whole bunch of health rewards, and we'll talk about that in a few minutes. In addition to cardiovascular conditioning, we should also pay attention to our muscles. And we know that past the age of 30, we start to lose muscle strength. Our fibers that make up our muscles start to deteriorate. Our bones get a little bit weaker over time. So it's very important that we also add in at least 2 times per week muscle strengthening activities. And that might be using your own body weight, a soup can, a water bottle, a dumbbell, or a rubber elastic band, working the upper body, lower body, and core with repetitive activities that don't make you work too hard or not too easy, but just in the middle. Do that a couple times a week, and the combination of the two are the keys towards success, whether we're trying to prevent disease or manage the health conditions that we might be living with. On a Canadian perspective, so the vast majority of Canadians, when surveyed, will view physical activity as a serious health issue. The vast majority will say that they enjoy being active. About half will say they don't really have an excuse for not being active. And most people have at least the wherewithal to say that they are the ones responsible for all of this. So it sets the tone that at least our views upon physical activity are indeed very positive. However, in stark contrast, maybe no surprise not to the people on the phone, but to those around us, that the vast majority of Canadians are in fact not meeting the physical activity guidelines. And estimates from Statistics Canada or Public Health Agency of Canada are in this ballpark, that about 85% or even more of Canadian adults are not meeting the 150 minutes per week physical activity guideline. So in stark contrast to where we think we should be, we are really at a much lower level. And for an optimist like me, I say, well, that's okay. This creates a wonderful opportunity to make a big impact in our society, but there is a long way to go. We could view the counter to not being active is, of course, sitting too much. And indeed, Canadian adults are sedentary for more than 8 hours per day. About 86% of Canadian adults would say, indeed, this is the case. And about 25 hours out of the week are spent on gaming, screens, use of technology for leisure. And gosh, during this time of the COVID pandemic, maybe this is even higher than even before. And this is part of the so-called collateral damage of the pandemic, that we are certainly not being active as we should be. And interestingly, single men might in particular be a cohort who are at elevated risk of extensive leisure time sitting. So for all the gentlemen on the call, you can watch the rest of this standing up. Thank you very much. The economic burden that arises from these sorts of patterns of activity are enormous. The annual healthcare costs from physical inactivity have been estimated to be as high as $6.8 billion in direct annual healthcare costs. In terms of indirect costs and societal impact, the number gets amplified dramatically, and it's thought that the societal costs related to health burdens, lost productivity, time away from work through to disability, $29 billion is the impact on our economy. And again, men may actually account for a majority of these issues, and they're certainly deserving of a shakeup and a wake up. The flip of this that agencies like the Conference Board of Canada have projected out, they would suggest that if we increase the physical activity rates in the population by just 1%, that we can accrue dramatic savings now in this next year of $2.1 billion, and over the next decade of $20.3 billion. So these are low-hanging fruit for us, and we really need to take advantage of these simple interventions. And this somewhat complex graph demonstrates how much do we actually need to start to get some impact on the chronic disease risk. And on the Y vertical axis is the relative risk of developing heart disease, expressed as 100% moving downward. And on the horizontal axis are measures of how active a population might be. And in this case, it's measured in leisure time physical activity. It could also be expressed as minutes of activity per week, or the amount of sweat that you are doing in terms of equity. So what we see is that there is a curvilinear response that's continuous. And even at amounts of 75 minutes per week of activity, that's like 15 minutes a day of brisk walking, we can actually start to bend the curve somewhat and see about a 7% reduction in the risk of heart disease over the next number of years. If we double up the activity to 150 minutes per week, then the risk of heart disease goes down by 14%. And then if we get out to 300 minutes per week, that's an hour a day, 5 days a week, then we can really get to the flatter part of this curve at about 20% reduction. So this informs programs like ours in cardiovascular rehabilitation. This is where we try to get our populations out to, of the 45 to 60 minutes per week. And Rob is going to tell you how we actually do that in the latter part of this presentation. Thinking about some other disease populations and disease conditions, if I had to ask you, what's the best way of preventing diabetes? We know that diabetes has a tremendous impact on our healthcare system, on our workplaces, on our families. And suggestions are that 1 out of 3 of us are either living with diabetes or living with prediabetes or at high risk for developing diabetes over our lifetime. And this interesting study from a number of years ago would have compared the interventions of, what if I just gave you some wise advice as a physician to say, I think you are at risk for developing diabetes, your sugars are a little bit high, you should really get active and you should eat better. And if I watched over the next 4 years, about 10% of you per year would actually develop diabetes. What if I offered you a medication called metformin, which is the most common medicine that's used to actually treat diabetes? Well, then about 7% of you per year will actually develop diabetes. Interestingly, if instead we offered you a health coach who would help you on your journey towards actualizing your best health, your best self, and being active 5 days a week, aerobic, 2 days a week, resistance, and eating better, well, we can actually half the amount of diabetes that will develop. And this is really highlights the importance of lifestyle and the power of physical activity. And not only for heart disease and diabetes, but if we think about physical activity in the brain, there are a whole host of interesting studies that would say mood improves the more active we are. And running or walking just a little bit will reduce the risk of major depression by 26%, which is as effective as many medications. Or many of us are concerned about declining cognitive function and reducing the risk of dementia. While we've been focused on what's the magical pill, we recognize that regular amounts of activity, as we described, can actually substantially lower the risk of declines in executive function and memory and learning. So this is very important to deploy in our regular lives. And thinking about overall death trading 30 minutes of sitting with instead 30 minutes of walking around can reduce your risk of dying early by 35%. And other common conditions that come on as we get older, things like osteoarthritis or hip fractures or falling and experiencing substantial morbidity. Well, these can also be lowered dramatically by being active. So what further information do we need? Are there any more excuses? The population's primed. We think that this is important. There's lots of evidence for it. Really, the call to action from today is to get ready, get set, put on your sneakers, get out, but not yet, because we have lots more information to share with you. And at this point, it is my pleasure to turn the presentation over to my colleague, David Langelier, who is a physical medicine and rehabilitation specialist. He works at Toronto Rehab and the Princess Margaret Cancer Centre. He is one of the very few cancer rehabilitation physicians in Canada who's focused on improving functional impairments and quality of life in all cancer survivors. He's been a brilliant new recruit to our program and will indeed do very exciting things in the clinical and research arenas. David, over to you to talk about physical activity and cancer.
Hello, everyone. Thank you, Dr. O, for your introduction. So I'm going to spend the next 10 to 12 minutes with everyone, sharing with the group the advantages of, as Dr. O mentioned, moving more. And so that's being physically active when it comes to the topic of cancer. So this information is relevant whether you've had cancer, whether you're suffering from cancer, or whether you're interested in how exercise might be a useful tool for you if you want to avoid getting cancer in the first place. And so really, cancer and exercise has changed quite dramatically over the last few years. Why is physical activity relevant to cancer? Well, in the Canadian context, in 2018, over 220,000 Canadians were diagnosed with cancer. And it's estimated that 1 in 2 Canadians will develop cancer in his or her lifetime. And although I know there are people joining us from India and other places in the world where cancer rates do differ, the rates are still very high, similar to cardiovascular disease in these populations. And so this is a major health problem. And the cancer and exercise environment has really shifted over the last 10, 20 years. Historically, when patients were diagnosed with cancer, they were advised by their healthcare practitioners and well-intentioned family members, for that matter, that they should rest, that they should conserve energy. And really, this was based predominantly out of fear that excessive exercise could potentially exacerbate your symptoms. We know cancer patients are fatigued and that it might actually make your fatigue worse. Or even more concerning for people was that exercise could potentially be unsafe in the setting of cancer. But over the last 20 years, we've really seen this shift from an old paradigm of thinking to this new way of thinking about exercise and the way it can complement treatment. And so this is from our exercise physiology world, where we've really seen that exercise can be an intervention, that it can be an augment for your treatment and potentially enhance your treatment. So where we think about treating cancer with chemo, with radiation, or potentially targeted therapies, exercise could be a targeted therapy that could be prescribed and can potentially actually help treat your cancer. And so there's more and more evidence to suggest that this is the case, that it can actually reduce, prevent, and it can improve your survival and improve quality of life. So when we look at the evidence surrounding cancer and exercise, a lot of work has gone into survival. And when we look 20 years ago at the evidence, it was preliminary, and it really focused on the tumor groups that had the most research behind them. So this was groups like our breast cancer population, our prostate population, colorectal groups, and less within our hematologic malignancies. And we've seen that there is increasing evidence to support to just move more, to try to increase your level of physical activity because it has a survival benefit. And so when we look at studies that were done by some of our colleagues, this was a study back in 2016 and still holds true today, if not even more so. And so I'll share that with you a little bit later. But when we look at mortality rate that's due to cancer, we can see significant improvements in if you're able to move more. So this study looked at breast, colorectal, prostate cancers, and they asked themselves the question, in patients that are moving more and compared it to people who are moving less, are people able to modify their risk of dying from cancer? Are they able to prevent recurrence? Are they able to prevent progression? And the answer is yes, that we now know that exercise and people that are moving more can potentially affect the trajectory of their disease. Now, why does this occur? This isn't the purpose of today's conversation, but what I can tell you is that there are kind of macroscopic and microscopic properties to exercise that have anti-cancer effects. And this is still a very much evolving area of medicine, and it's a very exciting source of research for our bench researchers. But when we look at the macroscopic properties of exercise in the cancer setting, we see that people who are moving more and they're moving at a moderate to high intensity, they can tolerate their treatments better. So in a study of women with breast cancer, and that were participating in moderate to higher levels of physical activity in a supervised program, they required less dose adjustments, they were able to complete their chemotherapy on time, and they experienced less physical decline, nausea, vomiting, less pain, and they actually had improved muscular strength and reduced fatigue. All things that are very important in a cancer setting. And so this can actually help our cancer treatments. I think what's even more exciting is we're starting to see in some animal models the way that tumors behave in the setting of exercise. And we're seeing that we can actually augment the immune system when people are exercising more. Now, this is still an evolving area of research, but we're seeing that potentially you can actually increase surveillance, activation of your innate immune system, that you might actually improve the mobility of your natural killer cells that help fight cancers when you are exercising more. And that you might be able to actually improve the treatment response from cancer. So it's not only making you be able to tolerate the treatment, but it might actually improve the tumor's response to chemotherapy or radiation if you exercise right before. So this is very exciting and a new area of research. And I'm happy to discuss this further later on, but I think that we'll move forward. So this is hot off the press. So when we look back 20 years ago to what I as a clinician had to sit across from a patient and discuss physical activity, and patients are asking about what's the evidence. You know, I sometimes saying, well, if you have colon and breast cancer, you need to move more. But the rest was, we think you need to move more. But now fast forward 20 years ago, this is now a synthesis of the evidence from the American College of Sports Medicine and the Roundtable that analyzed a whole body of literature in the prevention of cancer and said, in people who are moving more and exercising, can we prevent cancer? And there's a strong evidence base now for colon, breast, kidney, endometrial, bladder cancer. And there's emerging evidence to support some of our other cancers. And if I had a crystal ball and was able to look forward and say, what's it going to look like at the next edition in 20 years? I suspect many of the areas that we have limited evidence will show stronger evidence to support physical activity. I think right now we're in that exciting period where we're trying to say, well, what does that physical activity look like? What is the prescription? Should it change based on the type of cancer that you have? And so that's the areas that are currently being investigated in this population. So this slide looks very similar to the one that Dr. O presented. These are our general guidelines for physical activity for all comers. And they need modifications based on certain impairments or if you have certain cancer perspectives. But in general, we're striving for that mixed aerobic and resistance exercise, at least 150 to moderate vigorous exercise, 2 to 3 days of resistance-based training at a moderate level. We also want to make sure that we're stretching out areas that we've been working out on the off days to improve our flexibility and prevent our chances of getting musculoskeletal injuries. When we put a cancer lens onto those general guidelines, the American College of Sports Medicine has said, well, maybe there is actually benefits that are achieved at lower levels of that physical activity. We still want you to move more and to do as much physical activity as possible that's safe, but we're seeing benefits at even lower threshold levels in the cancer context. So if you can, exercise 3 days a week, at least 30 minutes. Resistance, still about 2 days a week of exercise. And you may want to have some guidance, some support or supervision to be able to make your exercise program safe and effective, and to help with health coaching. What I encourage people is, if you have a cancer diagnosis, that you do speak to your doctor about engaging in exercise. And there are various questionnaires and things you can do online, such as the PARQ Plus, that can help guide you to say, is exercise right for me? But I would say that in my clinical practice, there are very, very, very few times that I have restricted exercise for patients. Some level of physical activity is usually possible with patients. It's just a matter of what it is and what does it look like. And before I leave you, I do want to just point out, when we look at impairments that are common in cancer, so we're looking at fatigue, anxiety, psychosocial distress, quality of life, very profound side effects that cancer can cause on the survivor and their family. Aerobic, resistance, and combined programs are really starting to emerge that we can change these impairments, and that there may be in the future possibility that if you suffer from cancer-associated fatigue, that we know the exact prescription. Perhaps it's more aerobic than resistance exercise. And so this is a very exciting and evolving area of exercise research, and I think we'll know more in the coming years. Thank you.
Great. Thank you so much, David, for sharing your wealth of expertise and knowledge with us. The example of cancer is so compelling that it illustrates how the evidence is really building over time, and we're right in that sweet spot right now where there's a wealth of information coming to the table, and not only can we prevent disease, we can manage it much better, and the treatments that we have available can be made better by being active alongside. At this point, we're going to turn the conversation over to the capable hands of my good colleague, Robert Bertelink. Rob is a registered kinesiologist and clinical coordinator at Toronto Rehab's Cardiovascular Disease Prevention and Rehab Program. He's been with us for 26 years. He is a real champion and advocate for high-intensity interval training. He'll tell you what that is for our cardiac populations. And he has built a wonderful special program for people living with advanced heart failure. So there's nobody who can't exercise in Rob's mind, and he'll tell us how that can actually work. Over to you, Rob.
Wonderful, Paul. Thank you very much for your presentation, and David as well. Absolutely fantastic. I just want to tie on the last comment that David just made about taking a look at cancer and exercise, and his thinking that down the road, a lot of the symptoms that are brought about by cancer will be able to treat with exercise. One of the things that I always tell a lot of my patients is that we know a lot of chronic conditions can cause problems. Heart disease can cause problems, cancer can cause problems, a lot of symptoms, fatigue, lethargy, and stuff like that. We know that happens with it. But one of the things that always bothers me an awful lot is a lot of people with these chronic conditions, they don't go and exercise. So not only do they have the problems that are brought about by the condition, which are very, very real, but then they layer on top of that just getting out of shape and deconditioning. And I always scratch my head at that. If you've got some kind of medical condition that makes you feel bad, why would you make yourself feel even more bad by trying to get out of shape? So exercise is a really big factor. And I always tell people, I've got the easiest job in the world, because no matter what the question is, my answer is always going to be, yes, exercise is important. You should be looking to do it. So now that Paul and David have made the case that we really do need to make sure that we lead an active, healthy lifestyle, I guess I just want to spend about 15 minutes or so, 10, 15 minutes, just talking about what that could look like. When I think of an active lifestyle, it's really got 4 components, and these were alluded to by both David and Paul. So an active lifestyle is going to have aerobic components. Aerobic components specifically are to improve your cardiorespiratory fitness. Your heart is a muscle, and we want that muscle to get stronger. And that's what aerobic training is going to do. So that's one component. The second component, of course, is resistance training. Resistance training is very important to keep the muscles going, which helps with your metabolic conditioning, keeping your cholesterol in check, your blood sugar in check, helps with a lot of orthopedic concerns. If you've got arthritis in your knees, making sure you've got good, strong musculature will help with that. So that is key. Promotes independent living, lots of pluses with resistance training. Stretching, third component, making sure you add that into your lifestyle is very, very important. And then the fourth one is making sure that you're moving regularly. Dr. O showed us some really scary slides about the amount of time that we're all kind of sitting down and not moving. We need to do something about that. So these are always the four components, and I encourage you, if you're out there listening to this presentation, to think of your active lifestyle in these four pillars and make sure you're doing the right stuff for each one of those, just to cover all your bases. So let's take a closer look at these. A reminder, so what are our targets? Chronic disease all over the place. They say the minimum amount of aerobic activity that you should be looking to do is 150 minutes. Dr. O showed us this slide, and that's exactly what he said. Also from the cancer side, David showed us his slide as well, 150 minutes, maybe a little bit less for the cancer patients, closer to 3 times 30 minutes, so 90, but you still want to make sure that you're active. So those are our minimum targets that we want to try and get to. So aerobic training, what is aerobic training? So aerobic training is exercise that's done specifically to make your heart a stronger, more efficient pump. Every cell in your body requires a constant supply of oxygen-rich blood to function properly, and it's your heart's job to make sure that happens. The stronger your heart is, the more oxygen-rich blood you're going to be able to deliver. And when you take a look at all those mortality curves that Dr. O was showing us, we know that the more oxygen-rich blood your heart can deliver, the better your mortality is. So how do we go about doing that? Lots of different ways to go about doing aerobic exercise. We've got 4 wonderful examples here, whether it's going out for a walk or a jog, biking, swimming, using stationary equipment. The key with aerobic exercise is to make sure you're doing an activity that uses enough muscle mass that the demand for oxygen-rich blood is going to increase enough that you're going to get a heart rate response. So what the activity is, your heart doesn't really know. You know, I always say, bless your heart, it's a wonderful organ, but it's not smart. All your heart knows is, hey, legs are moving, I've got to send oxygen-rich blood. So whether it's because you're biking, whether it's because you're walking or using an elliptical trainer, your heart doesn't care. It's just going to send the oxygen-rich blood. So you want to pick an activity that you enjoy, that's easy for you to do on a regular basis. And when you take a look at the COVID restrictions, is maybe something that you can do in the current environment. So getting out to a gym, that's not going to be possible. A lot of them are closed right now. We just can't do that. If you're over 70 and you're spending a lot of time isolating, maybe just doing some marching in the spot will work. As long as it gets your heart rate up, you're going to get that training benefit. Generally speaking, with my patients, I encourage them to target a minimum of 30 minutes at a moderate intensity, 5 days per week. 5 times 30 gives us that target of 150 minutes that were mentioned by Paul and David before. And that's as a minimum target. I really do feel the need to stress that. If you can comfortably do 30 minutes 5 times, you really should be thinking about trying to build up to 35 to 40 and 45. As you increase those sessions up to 5 times 60 minutes, the benefits that you're going to get are going to increase. So you want to try, if you can, to kind of bump that up, because there are going to be benefits that you get from that. Now, a lot of times people will say, Rob, you've talked about moderate intensity hard work. What does that look like? So in our program here, I'm very lucky that we're able to do cardiopulmonary exercise testing, where we put you on a treadmill, we cram this tube into your mouth, we measure how much oxygen you can deliver to the working muscles, and then I prescribe exercise in a way of walk maybe 3 miles in 51 minutes. Each lap should take 2 minutes and 8 seconds. We're very, very precise. but we don't have to be. There's a lot of common sense that we can use with our exercise. This is a nice lay description that's provided by Exercise is Medicine Canada, and it breaks intensity down into light exercise. And you can see here, light exercise will usually not cause adults to sweat and breathe harder. So you can go and have a comfortable conversation. Walking is a good example of that. You can go for 30, 45, 60 minutes without any problems, and you're okay. So that's light exercise. As Dr. Rowe had hinted early on, I tend to try and push a little bit more. I'm more of a fan of the moderate intensity exercise for everybody. This is going to make you work a little bit. You are going to be breathing a little bit. You can have a conversation, but you're not talking nonstop. You are breathing a little bit harder, and talking nonstop is going to be a little bit more challenging. You'll start to sweat a little bit. You'll want to take a little bit of a break from your talking just to catch your breath. This is a good level of exercise intensity to target. Remember, your heart's only going to be as fit as you ask it to be. So if you go out for a 60-minute light walk, I mean, that's good. It'll help your cholesterol. It'll help your blood sugar. It'll help your blood pressure. It'll help keep the weight off. All very good things that really help mitigate risk. But your heart's not really going to have to work very hard to do that. And if your heart's not working very hard, it's got no reason, it's got no incentive to get stronger. And once again, it's that stronger heart muscle that's associated with a lot of those mortality benefits. So you got to make it work. You got to give it a chance or a reason to get stronger. So moderate is a good option. A vigorous intensity exercise, what we call high intensity interval training, is something that I'm a big advocate for. For this, you're actually pushing yourself at a pretty hard level. I often tell my patients, if you're doing high intensity interval training, and I walk by and I say, "Hey, Steve, how you doing?" Steve should be saying, "Hang on a second, let me finish this interval." With high intensity interval training and vigorous exercise, you're exercising at a level where you're really pushing your heart at a high level, and you're really pushing it to improve its pumping ability. This is a great way to improve your fitness level, but it can be quite demanding. And I would strongly encourage anybody who's interested in this type of exercise just to make sure that you're clear to do so with your doctor before you really push. As I said, I'm a big advocate of this. I have people waiting for heart transplant, living with mechanical hearts, having had heart transplant and heart failure. And the vast majority of these people, if it's done properly, can actually do high intensity interval training and get some fantastic results. But they do need to be medically supervised for this and medically cleared before they get into this. Knowing that this is a general education session, I really need to make sure that's clear to everybody out there. Okay, so this is one way just to gauge your intensity. And as I said, we should be looking to push for the moderate intensity. If you got clearance for your doctor, vigorous intensity is a good way to go. So moving on to resistance training. So resistance training is also something that's very important. Interesting in our population, I get a lot of people that can get up to 45, 60 minutes of walking 5 times per week with no problem. But getting them to add resistance training seems to be a little bit more difficult. Resistance training is a very, very big part of an active lifestyle, a healthy lifestyle. Pretty much everybody should be looking to do it. The benefits that you get are numerous. I do feel the need just to kind of point out, we get a lot of people that are saying, I want to lose weight, I want to lose weight. You know, people are trying to lose those COVID pounds that we're putting in from that sedentary lifestyle sitting beside the fridge. Resistance training is the best way to try and look at body composition changes. You'll burn more calories in an hour of walking than you will in an hour of resistance training. But the interesting thing with resistance training is your metabolism, the amount of calories that you burn, will stay elevated for upwards of 2 days after that 1 hour's worth of resistance training that you do. And that actually adds to an awful lot of extra calories burned. So body composition, if you're interested in that, resistance training is really something that you should be looking to target. A lot of my older patients are often saying, Rob, I've got arthritic knees, my hip bothers, my back is sore, I can't lift weights, I've got the arthritis. Well, one of the things we know with arthritis is a lot of the time it's a degenerative change as we get older. you know, in your knees, your upper and your lower leg just kind of slide around like this, and that causes the cartilage inside to kind of wear down a little bit, and that causes pain. So a lot of people will say, I just don't want to do so much with my knees because it hurts. But if you work if you work leg weights into your training session, that'll tighten up the muscles around the knee joint. And instead of a sloppy joint that slides around, you'll have a very tight, solid joint that doesn't slip as much. And that will help decrease the wear and tear that's associated with arthritis. So I actually argue with my patients, if you've got arthritic joints, you need to do resistance training more than anybody else, because it will help with your joint pain going forward. A resistance training program is really meant, the one that we look at is meant just to provide overall health and wellness. It's very difficult for me to show you a whole bunch of exercises and do them in a 15-minute online presentation, but I do have some resources that I'm going to show people down the road at the end of my presentation. Hopefully you can go and take a look at those resources. I've got short videos that will show you how to do them. So resistance training done 2 to 3 times per week is ideal. Stretching is a big one, especially with so many people with the sedentary time that they're setting inside. So doing stretching is something you can do. You don't need an awful lot of space. As long as you've got kind of enough room to make your arms go, you can get some stretching routine in. Dynamic stretches are stretching with an awful lot of movement. You can see them here on screen. These are 4 dynamic stretches that we get all of our patients to do before they do their exercise. Just some marching on the spot to get the blood flowing, loosen up the hips a little bit, get some shoulder rolls. A lot of people are spending time at their computers doing a lot of typing and whatnot, hunched over keyboards. You get a lot of tightness and a lot of stress in here. So just loosening up the muscles in the upper back, the trapezius, that's going to help. Doing some leg swings to loosen up the hips is great as well, and some ankle rolls. I'll talk about these a little bit when we talk about sedentary behavior, but doing these dynamic stretches a couple of times per day, they're really only going to take you maybe 20 to 30 seconds per activity. 4 of them, it's a 2-minute commitment, maybe twice a day. It's not an awful lot. The hardest part about dynamic stretches, and really the hardest part about all this exercise, is just creating a routine that you can follow on a regular basis. We've also got some static stretches here. These are ones that you can do after you've warmed up your muscles a little bit. We usually encourage patients to do these after the resistance training exercises. Resistance training does, as I say, work the muscles, might cause a little bit of damage to the muscles, which is a good thing, because when that damage is actually healed up, that's how your muscles will heal up bigger and stronger, but stretching will help alleviate some of those symptoms. So stretching is something else that you want to try and do, at least on a daily basis, potentially even twice a day, beginning and end of the day is a good thing to try. Fourth thing that I want to talk about, our 4th pillar, is daily movements. We know that sitting for an extended period of time is associated with a lot of negative health outcomes. So you got to get up and you got to move on a regular basis. What does that mean? Typically every 2 to 3 times every hour, just get up and move. You don't have to do an awful lot. Just get up and do some of those stretching exercises. I think that's always a good idea. In my mind, when I think of this sedentary behavior, I'm always thinking about snow globes. And I'm not sure if all of our speakers out there are familiar with snow globes. They're these round glasses with these Christmassy snowy scenes inside, and you shake the snow globe and all the snow flows through this inside of this glass orb. It looks like a nice wintry day. When it's 30 degrees out in Toronto, some people might be wanting to see those cooler days again, but it looks really, really pretty. But then you take the snow globe and you put it back on the shelf and you kind of forget about it. And all that snow kind of settles into the bottom of the globe and it turns into this white, ugly, sludgy mess. And it really doesn't look as pretty anymore. Well, I think of people as snow globes. All right, when we're moving around and stuff like that, that's us shaking the snow globe. And you get all the snow falling all over. It's like our metabolism. We want our metabolism to be active and moving all over the place. This is great. But then if I go and I sit in this chair and I sit here playing like solitaire and I do that for 3, 4, 5 hours, my metabolism is going to get really slow and really sluggish, and that's going to contribute to all these negative health outcomes. So getting up every 20 to 30 minutes, you don't have to go for a big walk. Just get up and walk around the table or the couch a couple of times. That's like shaking your snow globe. And that's going to do so much for your metabolism. And it really doesn't take an awful lot of time. So many people live on their smartphones. Set the timer for every 30 minutes. I got one of my patients who's working hard through these COVID times. I told her to set the timer on her stove. So every 30 minutes, it starts annoyingly beeping at her, and she has to get up out of the office, walk to the kitchen, turn the thing off, because it drives her crazy. But you know what? It gets her up every half an hour. So doing things like that would be great. And I'm going to encourage, if you've been watching my video and you've been sitting for this whole presentation, stand up. Stand up for the next 3 slides, and then you can sit back down. So I said that I would mention a few resources. There's lots of stuff on the internet. Some of it's really good. Some of it is not so good. So these are a few resources that we vetted through our program. If you go to these, we're quite confident that you're going to get good material. For aerobic exercise, there's Start Walking at Home, interval trainings through American Heart Association. Our colleagues at University of Ottawa Heart Institute have got fantastic resources. And as do we, Cardiac College. I'm going to put a big plug in for our resistance training that we have on Cardiac College. They're short 2-minute video clips that might show you how to do a bicep curl, how to do a squat. They're wonderful clips. Go take a look at those, and they'll walk you through a whole bunch of different resources there as well. Cardiaccollege.ca. We also have diabetescollege.ca. They're both lumped under Health University. So you go there, wonderful resources. Okay. There's some other things on starting aerobic exercise programs, the resistance training program, the dynamic stretches. It's all there. Please take advantage of those resources. All right, so just to wrap things up, take a look at all those 4 different pillars of leading an active lifestyle. Think about each one of those and how can you do a little bit for each one of those pillars to support an active lifestyle. Okay, thank you very much. That is it for me. And I think I'm going to flip it back to our moderator, Dr. Paul O.
Terrific. Thanks, Rob, for an excellent presentation overview and some really practical tips. This is the question and answer period. You see the email on the screen at trf@uhn.ca. We have a number of questions that have come in already, and let's kick this off. So, Rob, now that you're warmed up with your exercise, warmed up with answering questions, a couple around the resistance training. Here's a specific one. If you spend 2 to 3 hours per week doing resistance training at a fairly high RPE level above 15, do you think this counts as moderate intensity aerobic activity as well?
So very, very good question. And as I said, you know, bless our heart, wonderful organ, but it's not smart. So all the heart knows is it's got to send oxygen-rich blood to all of those working muscles. And we know that it's going to get its benefits based on its heart rate. So if you're doing a resistance training program that's an hour long, 3 times per week, and you're doing it in such a way that there's not an awful lot of recovery time between the exercises, and you go and you check your heart rate at your wrist or your neck or your Fitbit or however, and you find that your heart rate is up at a good level, you find that you're short of breath and a good chunk of that workout is like that, then yes, absolutely resistance training can provide a significant amount of cardiovascular, cardiorespiratory fitness gains as well. So definitely, two birds with one stone.
Thanks, Rob. And David, we heard that exercise was good for a range of different types of cancer. Specifically, would you recommend exercise for someone living or recovering from a lymphoma?
So great question. So I think that the evidence is still evolving in some of the hematologic malignancies, and it also depends on where you are in the type of cancer and where you are in your journey through cancer, whether that's with an initial diagnosis and active treatment, or whether that's on the survivorship phases if you've received a cure. And so I can't speak to any specific type of lymphoma or in this specific circumstance, but what I would say is that a combined aerobic and resistance exercise program has been looked at in certain types of lymphomas and has been found to be beneficial. we do know some lymphomas are actually indolent, which means that they're kind of grumbling along and they're not overly active, but people can have them for a long period of time. And we would still recommend for those patients to speak with their healthcare provider and find an exercise program that can mix an aerobic and resistance exercise program with that stretching that works with them. So they can obtain the same impairment benefits, but also potentially affect the cancer itself as this evidence is emerging.
That's great, thank you. Exciting possibilities. Rob, into the 4-category model of being active, where do you think yoga fits?
So yoga, I think, is going to definitely, I would probably put yoga in the stretching components. Yoga is fantastic in terms of working range of motion. There's evidence supporting that practitioners of yoga help with blood pressure. It's a wonderful way of controlling the risk factors surrounding stress. So definitely a fantastic activity. I would probably lump it in more with the stretching. And of course, you're not sedentary when you're doing yoga, so probably in there. I don't think yoga per se is going to provide an awful lot in terms of cardiorespiratory fitness gains. So I don't think I'd really consider it a form of aerobic exercise. And generally speaking, most types of yoga are not going to provide an awful lot of resistance training. Some of the more extreme ones out there might do a little bit, but I think for the the general yoga that we tend to think about, not too much in terms of resistance training.
Thanks, Rob. And perhaps another nuance is, how we might view the term yoga differently in North America versus our colleagues from across the seas, where yoga might have a more holistic and entire life sort of reach, where it might actually touch on more pillars. So thank you for that question. David, appealing to the physiatrist in you, if you were working with a senior who had chronic conditions like diabetes and arthritis, one of our questions is walking 10,000 steps to 15,000 steps per day enough, or even too much? If not, what additional exercises would you recommend?
So first, I just want to circle back to the question you posed for Rob. From a cancer perspective, there's actually an increasing body of work looking at yoga and the different types of yoga in the cancer populations. And I think it's not just about controlling the cancer, but also some of the impairments. And there has been some evolution of the mind-body improvements that we see with yoga in the cancer population, the psychosocial benefits. There's also that breathing and breath support, and also some of the core and balance that you can get from a yoga program can be quite substantial. So I think it's, again, an exciting area that's evolving in the cancer population, but we would still want you to be trying to engage in the aerobic and resistance exercises in addition to that, if possible. In terms of your question, Dr. O, if you have multiple comorbidities, I think striving for any level of physical activity is where I would like to start. And so if you're able to get to that 10,000 or 15,000 steps, my next question to this person would be, well, how fast are you doing that? What time of day are you able to obtain those steps? Is it at 9 p.m. or are you getting to that steps at 10 in the morning? And how can we move from there? So I think it's about creating those stepwise goals and then trying to increase that. So can we increase the intensity? Can we increase the duration of the exercise so that you can potentially tap into some of those stronger benefits? Because as you discussed earlier, Dr. O, we think that there's this graded response. We believe that the more exercise that you do, the potential of more benefits you may have for many different reasons. And so it's about how can we increase that level of physical activity. So that's the question I probably pose back to that participant is, well, what's next? I think that that's great that you're moving, but even if you can't obtain that 10,000 steps, striving for that first 5,000 steps and then working to 7,000 steps and working your way up in a very progressive, safe manner, I think would be a very reasonable approach to exercise for most people.
Great, thanks, David. Rob, hitting on one of your favorite topics, if your exercise routine is intensive, higher intensity, we talk about moderate, what if I get into high intensity? Does that mean you can exercise less or I guess for a shorter duration?
Yeah, so generally speaking, that's one of the big reasons I know I like high intensity interval training. You can accomplish an awful lot with a reasonably small time investment. There's a concept out there, something called a MET minutes. And a MET minute or a metabolic minute is an attempt to try and capture the amount of effort that you're putting into your exercise, into your activity. So high intensity interval training would be a high MET minute value. So if you were to do, as an example, and these numbers are just as examples, they're not real. If you were to exercise at a value that was 100 MET minutes, and you did 10 minutes of activity, that would be 10 times 100, that would be 1,000 MET minutes in 10 minutes worth of work. The other way you could go and take a look at it is if you go at a much lower intensity, maybe you're only exercising at 50 MET minutes, you'd have to walk twice or exercise twice as long to get up to the same value. So higher intensity activity can accomplish a lot of those benefits in a significantly shorter period of time. Generally speaking, for my patients that I work with that I prescribe high intensity interval training in, an aerobic prescription would typically look like exercise at a high intensity interval training program. There are many ways to do that. They all typically take about 20 to 30 minutes to do. So they would do their HIIT workout 3 times per week for 20 to 30 minutes. And then I'd still encourage people to go out on 2 longer walks, because I do think there is some merits in going like 45, 60 minutes at maybe a moderate intensity. I think there's health benefits to that as well. So, but that does shave off potentially, an hour and a half of training time a week.
Great. Thanks, Rob. David, I think we're going to wrap up with this question. And Rob, I'd invite you to comment as well after David. Given the breadth of people who we work with at Toronto Rehab, we do meet some people who might have mobility challenges. They may be in a wheelchair, they may be using walkers. What exercises might we be able to use to really give a good workout, cardiovascular and otherwise?
So I think that this is where we have to be creative, and we have to look at the patient and their potential barriers for engaging in aerobic and resistance exercise, but know that we can overcome them. So for example, if you have a spinal cord injury, we need to look at that very differently than we would with somebody who can engage their lower extremities. But that doesn't mean that we can't still get the heart rate up, that we can't use the upper extremities to create a cardiovascular response, to get that blood moving and make that heart pump. And so, for example, like wheelchair basketball or wheelchair sports is a way that we can engage the upper extremities to compensate potentially for our lower extremities if they're not, if we don't have any motor function there. That's just one example. But, in our amputee model or patients who have had a limb loss, we can still exercise. And in patients that have cancer, sometimes if you have really bad arthritis or if you have difficulty with mobility, sometimes using an aquatic model or going into the pool and exercising with the resistance off the joints can be a very effective method. So what I would encourage people on this call is if you're experiencing challenges from whether it's muscle or bone problems, or if it's nerve related, to speak with your healthcare provider, your family doc or a sports med physician, kinesiologist, some kind of exercise professional, and explore how can you tap into the benefits of exercise. Because as I mentioned before, it's, I would say, very rare for me to say that I tell patients not to exercise at all. It's just a matter of what does it look like. And I think what's also important is what gets you to move, what motivates you. I'm not going to throw you in a pool to exercise if you hate water. So then it's about trying to engage for your barriers, what makes you want to exercise and can motivate you for that long-lasting change.
Great. Thank you so much, David. And hearing from the doc, very inspiring. Hearing from the exercise professional to close us out, Rob, any final thoughts?
I'm going to echo David's thoughts. I know we're pressed for time. I'm going to agree with everything that David said. I've been doing this for 26 years now. I've yet to meet someone that I can't find a way to train them somehow. The only thing that can be a little bit challenging, touch touch wood, all my joints work. I can go and exercise pretty good. And, you know, the issues I might have to deal with are time. I'm just a little bit tired. For people that do have some mobility issues and pain and stuff like that, all the respect in the world for them when they do go out and exercise, and it's not easy to do. We can make anybody, we can find ways for everybody to train, but I know we do acknowledge for some people it's an awful lot harder. So just spending a little bit of time to, you know, acknowledge that fact. I do understand that there's going to be a little bit more effort involved, but to reassure them that the effort is worth it and they will definitely get gains from it.
Great. Thanks, Rob. All right. We are closing out this session. It was terrific, and I hope everyone did enjoy it. We've all gotten some important takeaways that will help us make better, healthy lifestyle choices. Thanks to Dr. David Langelier and Rob Bertelink and all of today's sponsors for making today's webinar possible. For those of you who would like to view the session again at a later time, or share it with others, we will provide each of you with a link to the recording in the coming week. We would like to invite you to join us again for our next wellness webinar that's coming up on Wednesday, June the 24th, that is shown on this slide. And the topic will be about navigating our new reality, where senior UHN experts will speak on the topic of transitioning back to work and community life during the COVID-19 pandemic. Now that we were all jazzed up about being active, here's an opportunity for you. There is a national walk of life that has been running for over 25 years, and this is in support of our cardiovascular prevention and rehab program. Toronto Rehab Cardiac Team will be sporting a virtual opportunity, and on Saturday, June the 27th, at any time during the day, we encourage you to do your 30 minutes or more in the way that suits you, and you can donate, walk, run, or fundraise on behalf of the team to allow us to continue to do this great work around staying active. And the next slide will, again, thank all of our sponsors for making this possible. We want to thank all of you for taking time out and joining us and being part of our wellness community. And we do look forward to connecting again in the very near future. Have a wonderful day, everyone.